Dr. Jaban. So there's a repeating theme that's come up this week from a lot of people across the country that I'm working with. And they feel like going to the chiropractor, doing physical therapy, working out just doesn't work for them. No matter how much they do to keep their body put together, it keeps coming apart. So what does that mean? It means that you go and get an adjustment, or you go to physical therapy and do rehab, and no matter how much time and effort you put in, you walk out of that office and you feel like your joints just come apart. You're back out of place. So they get you feeling better, but as soon as you walk out, it just doesn't work. You're going to the chiropractor 2, 3, 4 times a week. You're doing physical therapy. You're doing exercises at home. You're doing your yoga, your Pilates. You're doing it all, and it just doesn't hold. Here's why. So I am a chiropractic physician. I do have my doctorate there, and I've worked with a ton of chronic illness, autoimmune people, because when I first got into practice, although Lyme was my focus, it was also that I wanted to help people feel better. So I wanted to use that other skill set that I put together going through chiropractic school to help. So here's what I did. I'd start working on people. And adjustments, even though I thought I was a pretty decent chiropractor, didn't seem to ever hold. And they would complain, the patients, of they've been to 10 chiropractors and it never worked. They went to chiropractic and physical therapy and got injections and exercise and then didn't do anything, and it still didn't hold. So what I found out was, through doing a lot of different muscle testing, through doing a lot of extra work to help check joints, talking to kinesiologists, talking to muscle testers, talking to scientists, if your body is stressed out, if it's overwhelmed with infections and toxins, then what happens is the tendons, the ligaments, the apparatuses that hold your joints together, they actually become more lax, so they don't hold well. So as soon as stress hits, whether that be walking and your feet hitting the ground, or that be an emotional stress or a work stress or an infectious stress that happens, that flares up when you walk out of the office, when you go home, when you go to work the next day, then the joints become lax and everything just comes apart. So then you get the patient, whether this be you or someone that I've worked with, who says, well, it just never works for me. It doesn't last. I feel better walking out, but it's only 12 hours, 24 hours. So what do you have to do to get well then? How do you get your joints to stay stable is what the biggest question is. And what you have to do is you have to actually treat the root cause. So it goes back to removing the infection, removing the toxin, removing the stressor from your life that is keeping you bogged down. And may not be one stressor, it may be 2, 3, 4, 5, or 10 stressors. And as those reduce, the adjustments start to hold. So time in and time over and over and over again, what I have found was that after about 2 or 3 months working with people, their adjustments start to hold. After we get the stress reduced in their bodies from the infections and toxins, their adjustments start to hold. Whether it's my adjustment, which I don't do as much anymore, I have doctors in my clinic that do a lot of the adjusting for me, or whether it's somebody else that I've never met that's seeing their chiropractor in a state from far away, because I do a lot of virtual work, they start saying my pain is reducing. My chiropractic adjustments work. I don't have to go 3 times a week. I don't have to go 2 times a week. I don't have to go once a week. I go once a month now, which is where it should be. Chiropractic is awesome. Physical therapy is amazing. Combining the two truly help you to get well on your physical pain. But you have to have a body that's willing to accept the treatments. So if you've ever wondered why you just keep coming out of joint, why your chiropractic and physical therapy just doesn't seem to get the job done for you like it should, even though you are committed to your treatment plan, that's why. So if you know somebody dealing with this situation, please invite them to True Healing Strategies. Tag them on this video. We also put these out on YouTube, and we put them out on Instagram at different dates, so they may not all be coming out today. But if you know somebody, invite them to those things so they can see these. Thanks for watching, everybody. I hope this helps you to take one more step into hope so you can heal. Bye.